I was in nursing school at the time, and I didn't know what I wanted to do. And I came out of those summers believing that I wanted to be a nurse practitioner, which I am now, although there was a 20-year period of time in there when I wasn't. But I've come back to that 20 years later because of the Student Health Coalition. It really opened my eyes and showed me a form of health care that I was not familiar with prior to that, and how much I really loved having that relationship, that ongoing relationship with patients and families. I learned a lot about community organizing. That was a new concept to me, and I didn't really understand what that was about until I went back later in the summer as part of this project to assist in that effort in terms of follow-up after the health fair had been there, going back, being sure folks were taken care of, and being sure that the health council that had formed was meeting and that they were getting access to the resources they needed to, and that's when I first began to see that this effort was not from us, it was from within the community, and they had to do it. Meetings about revenue sharing and meetings about applying for grants, for clinic funding, and the persistence of the health council and going to these government meetings every month until they got the money that they wanted. And I think the persistence of that effort of saying we're here and we're not going away until we get what we want and get the resources we need. Again, I learned a lot from that. I think what we did was act as a catalyst and helped mobilize the resources that were already there and helped stimulate interest and get folks going to identify their own needs and then come together as a community and figure out what they wanted to do and what they needed to do to get health care into those areas. Had I not been able to see firsthand the hard times that some people have and the lack of resources that some people have, it would be very easy for me to be complacent and judgmental and much less compassionate in the care I give. And I like to think that worldview started with the Student Health Coalition, the summers that I worked with it.